Hello, today I am going to talk to you today about gut health and food sensitivity, and I am Dr. Magda Peronel. We're going to be discussing the connection between diet, health, and our gut. So in particular, we are exploring food sensitivities. There is a difference between food sensitivity and allergy, and that people commonly mistake. So the first thing is sensitivity. It is defined as an adverse reaction to a food, but there's usually a delayed response. And sometimes the person will not experience any symptoms, but there is something going on inside of them, and it can range to moderate response. An allergy is what we're pretty much familiar with, and that is a specific and immediate response to a food, and this is a true allergy. The most common allergens and irritants are the following: peanuts, cashews, almonds. Many of the nuts are a common issue. Shellfish, including lobster, including shrimp. Shrimp is probably the most common one. Dairy, and we're talking about cow milk, wheat, soy, and chicken eggs. So there are 5 designated proteins in our immune system. It's IgA, IgD, IgE, IgM, and IgG. When we are discussing food sensitivities, we are talking about the sensitivity and the immediate response. So the sensitivity, once again, is that delayed onset, and we're going to see a presence of IgG, as in George, antibodies. And for the immediate response, we are going to be seeing an acute elevation of IgE, and that's E as in Edward. So how do we test this out? There's several ways to do this. Pretty much the primary way is through blood. That's blood taken from your vein in your arm, or blood that is taken from a fingerprint. Then there's also hair analysis, which is not used primarily. That's generally an outdated way to look at food sensitivities. Factors that can alter the test. So it's very important that if you do go in to be tested, that your doctor discusses with you what is important to get the most accurate results. That includes staying away from some of the following for a time period: antibiotics, steroids that could be taken by mouth and even nasally can alter the results. Topical hormones, whether it be estrogen or testosterone. DHEA is another one that you have to be careful with. Probiotics, antihistamines, and there's some other medications that can also alter the test. Once again, you do need to discuss this with your doctor. So what are some of the symptoms that are associated with the immediate response and the delayed response? So the immediate response symptoms, some of them include vomiting right away, feeling very nauseous, having diarrhea, hives is a common one, angioedema, which is basically inflammation of the lips, some of the mucous membranes, even like the tongue, or you may see some redness or flushing in the eyes, and abdominal pain. For the delayed onset, like I said, some people may not feel anything, even though the blood test will reveal that there is a food sensitivity. And then the range can also go into a person actually experiencing something. Constipation could be tied to a food sensitivity, some abdominal pain, dermatitis, and indigestion. All right, so what exactly is happening at the physiological level? When the food is eaten and that food is exposed to the gut lining, when the body senses something is irritating it, it's called an antigen. And that antigen is going to react with the surface protein on the gastrointestinal lining. Then a cascade of immune responses starts to happen. And there is a stress response, and that stress response is interpreted by the brain. And that's when the brain will identify, is it something that belongs to the organism, which is you, or is it an outside invader? Now, once it deems that it's an outside invader, then that's when the cascade of immune reactions start to happen. And those cascades are involved in trying to get rid or dealing with the invader or antigen. So some of the side effects or the long-term reactions to that is gut permeability. And gut permeability is basically the tight junctions that are in the digestive tract that are supposed to keep things out, start to loosen because it's becoming weaker. So not only is the body going to destroy or try to send out the immune response to the invader, but it may also in the process destroy the healthy tissue. This right here is a picture of the tight junction and all of the components that are involved with food introduction and food consumption. So we do have an outer layer of mucus that's very important in a healthy gut. And then as you can see, you have the inner lining with the cells that are involved in the digestive process. So there are other organisms in the gut that can affect your response to the food. There could be some type of infection from viruses, pathogenic bacteria, which is just a fancy name for saying bad bacteria that causes us distress, too low acid count or excess acid. And it could be also excess mucus is also a problem in the GI lining. Once again, we did talk about medications altering the gut health, fungus, and other hormones. Hormones can be used topically or taken orally, and that will affect the gut. Additional factors that can also affect gut health: an unhealthy diet, toxins like pesticides, molds, or heavy metals, inadequate enzyme production, and that's usually an issue with our pancreas, an infection, and an altered autonomic function, which is talking about the nerve response to help with the motility of our gut. So what is the plan once the foods are identified? That is when you are responsible, or the doctor plans with you to remove those foods from your diet. And once those foods are removed, the inflammation does go down and decrease, but now we have to repair the gut with the tools that a doctor will use. And once that is implemented, then we need to replenish the gut with healthy bacteria. And then we can start a food reintroduction, but at that point, you will have to keep a diary or document what your response to the foods that are reintroduced are, because that will give us an idea of what truly becomes an allergy or a sensitivity. Conventional methods with food sensitivity or allergies really includes avoidance. That is what conventional doctors are going to focus on, which is avoiding the food. Previously, maybe about 20 years ago, there was the advent of weekly allergy injections, which is introducing the allergen to you every week and titrating or increasing the dose on a weekly basis. And then there is the epinephrine, which is the auto-injector that people will use when there's an anaphylactic response or life-threatening response to a food allergy. Food sensitivity is also used for other conditions. Obesity is one of them. There's constant studies going on with studying the gut biome and the connection to obesity. Also IBD, and that stands for irritable bowel distress, and those include ulcerative colitis and Crohn's disease. Mental health, which would be depression and autism, and other GI disorders as well. So what's the prognosis once you go down this line of identifying the foods, repairing and replenishing the gut? In most cases, these trigger foods are identified and your health dramatically improves once you undergo this food plan. And improvement is usually sustained if you avoid these foods. So it is a matter of lifestyle changes. And if testing and treatment doesn't produce the favorable outcomes, then now the doctor should explore other means of your complaints. And yes, children do outgrow their food sensitivities, but sometimes they are there and it stays with them through life. And sometimes as adults, it is not unusual for food sensitivities to pop up when we get older. So for more information on how to find out what your food sensitivity test reveals, contact Revolutions Naturopathic at 916-351-9355 to schedule a free 15-minute coordination meeting. We can also be found at our website on www.revolutionsdocs.com, and we can also be found on Facebook and Instagram.